Welcome! In this explainer, we're going to talk about a really important test for understanding your child's vision, especially, for those times when they just can't tell you what they're seeing themselves.
It's probably one of the toughest questions a parent can face. When your child is super young, or maybe they can't communicate clearly, you're left with this big uncertainty. You see them looking around, but are they really seeing? How do you get a real solid answer?
Well, to find that answer, we first need to get on the same page about how vision actually works. It's a little more complex than you might think, but it's super interesting.
Okay, so think of it like this. Your child's eyes are like tiny, high-tech cameras, but the brain is the powerful computer that actually processes all the pictures. Light comes in, travels down this whole pathway of nerves, and it's the brain's job to make sense of it all. So a problem anywhere along that path can affect vision. That's exactly why we need a test that looks at the entire system, not just the eyes.
So let's dive right into it. The test that gives us this amazing, deeper insight is called a VEP, and we're going to break down exactly what that means.
The name actually tells you pretty much everything you need to know. Visual, evoked, potentials. We show your child something visual, like a flashing pattern, and that evokes or creates a response. And we measure the potential, which is just a fancy word for the tiny electrical signal the brain makes. We are, quite literally, listening in on the conversation between the eye and the brain. It's pretty cool.
And the process itself? It's wonderfully simple and totally objective. Your child just watches a screen, kind of like a really simple video game. While that's happening, some painless sensors, they're really just little stickers, are listening to the brain's activity. The data we get back shows us the speed and the strength of that visual signal, telling us if it's getting through loud and clear.
So what does this actually look like on the day of the test? I know the idea of any medical test for your little one can be stressful, so let's just walk through the whole experience step by step to show you how smooth and reassuring it's all designed to be.
First things first, comfort. Your child can be right there in your lap or sitting in a comfy chair. Then we place those little sensor stickers on their head. Again, they're totally painless. Then they just watch the screen, and our equipment tracks the brain's signals. And finally, our specialists take all that data and figure out exactly what it means for your child's visual pathway. It's a gentle, straightforward process from start to finish. So, who actually benefits from getting a VEP test? Let's take a look at some of the main situations where this kind of evaluation can give you those crucial answers that a regular eye exam might miss.
If any of this sounds familiar, a VEP could be a really valuable tool for you. It's for kids who have a hard time tracking objects, or for those who were born prematurely, since they can be at a higher risk for some developmental delays. It's also key for kids with suspected cortical visual impairment, or CVI. That's a brain-based issue where the eyes themselves might be perfectly healthy, but the brain has trouble processing what they're seeing. And it's especially powerful for nonverbal children. It basically gives them a voice when their visual behavior is a mystery.
All right, so what does the VEP actually show us? Let's get into that by tackling some of the most common questions that parents have.
This is, of course, always the first question for any parent, right? And the answer, thankfully, is refreshingly simple.
Absolutely not. There are no needles, no shocks, nothing that causes any pain at all. It's as non-invasive as watching a little bit of TV. The only thing your child experiences is seeing some interesting patterns on a screen. That's it.
Okay, another really critical question, especially for parents with babies or nonverbal kids, is about whether they need to give any kind of feedback during the test.
And again, the answer is no. This is actually what makes the test so incredible. It completely bypasses the need for communication. We're not asking your child what they see, we're getting the answers directly from the brain's own automatic electrical response.
Let's talk practical stuff. How much time should you actually set aside for the appointment?
So typically, the test itself takes somewhere between 20 and 45 minutes. The main thing that changes the time is just how calm and cooperative your child is feeling on that particular day.
Now, this is a really important one for managing expectations. What kind of definitive answer does the VEP actually give you about blindness?
So, the VEP test doesn't give a simple yes or no answer to that question. Think of it more like a vital piece of the diagnostic puzzle. It tells us if the visual signal is successfully making that journey from the eye all the way to the brain. And that information is absolutely crucial for a neurologist to build a complete, accurate picture of your child's vision.
And this quote just nails it, doesn't it? Vision is so much more than just what the eyes can do. Getting this kind of objective data about the brain's response can be a total game changer. It can lead to earlier, more targeted interventions, therapies, and support that can make a huge difference in your child's development. This is how we get the real answers.
So, if you've been looking for answers about your child's vision, the VEP test offers a real path to getting a much clearer picture. It gives you objective data that can help you and your doctors figure out the best path forward. It really just empowers you with the knowledge you need to support your child on their journey.